Assalamu alaikum. Good afternoon, ladies and gentlemen. My name is Suhail, Assiri. I'm an orthopedic resident at National Guard Hospital. I'll be presenting our paper titled Predictors of Neurological Disability among adults following traumatic spinal fractures in Saudi Arabia. It's a retrospective single-center medical record review. In disclosure, we strongly assure that our team is absolutely neutral and made sure that there isn't any conflict of interest. In the introduction, traumatic spinal fracture is a significant consequence of traumatic injury worldwide. It can cause permanent, profound functional disabilities and lead to significant changes in the life quality and the lifestyle of the individuals and their families, with an annual incidence of 246 cases per million individual per year around the globe. And around in the developing countries, the incidence reaching around 25 cases per million per year. Due to this poorly interrupted epidemiological pattern and cause of traumatic spinal fracture in the region, we aim to report the incidence of traumatic spinal fracture at a level 1 trauma center in Riyadh, Saudi Arabia. Such data only will increase our understanding of traumatic spinal fracture and possibly facilitate an injury prevention program. We a consecutive patient who met the inclusion criteria of acute traumatic spinal fracture in 18 years of age and above. We exclude any pathological fractures, minor injury, transfer from other hospitals, and pure ligaments injury. Our data was retrospective from the trauma registry from 2001 to 2016. We defined the spinal fracture as any fracture in the spine based on trauma CT scan performed at presentation with or without neurological disability. And we define neurological disability as any type of weakness affecting the spinal cord at the time of trauma. CT scan was the method of diagnosing. Our data variable including age, gender, injury severity score, Glasgow scale, mechanism or method transportation, mechanism of injury, and ICU state. And our IRB approval. And we set a p-value less than 0.05 with a 95% of confidence interval to be statistically significant. We include the file number 973 patient after reviewing all the CT images with one musculoskeletal radiologist. We exclude 154 patient having no fracture upon reviewing the CT scans, and one patient had a pathological fracture. When we did the comparing of disability and non-disability group, patients who underwent surgery who had major injury severity score or transported by ambulance were likely to be disabled with a significant p-value. We did a univariant module in a regression analysis. It showed that injury severity score, as mentioned, along with patient underwent surgery and transported by ambulance, were likely or more likely to be disabled. We found that average age of traumatic spinal fracture is around 34 years of age, which is more or less around the few studies that was published in the region. This may be related to the average population in Saudi Arabia and the level of awareness driving at that age and the level of law enforcement in the roads. According to our regression analysis, patients above 65 years of age had 3 times higher incidence of developing neurological disability. This could be due to the fragility of that age group and indicate the need for specialized care and caution while dealing with elderly patients. Patient transferred by private vehicle has 60% better chance of avoiding neurological disability compared to those transported by an ambulance. This data should be taken with caution. Patients that were transferred by ambulance had more severity of the injury indicated by lower Glasgow scale and higher injury severity score. Preventive strategies are underutilized in Saudi Arabia and more of the developing countries. Improvements have been made, but more progress is necessary. Our study done in a single center, we could not generalize all our result to the entire country. And due to the limited sample size with the complete data, comparing seatbelt with non-seatbelt user was not conducted. We only included patient who had a fracture. We could overlook the patient who sustained any ligamentous injury. There's a high prevalence neurological disability were found in our study. Motor vehicle accident was the most common cause, re-emphasizing the strict rules that needed to be implemented in the roads. Awareness about safe driving and possible injuries with a motor vehicle accident should be addressed in the community and the law enforcement. And further studies should attempt to improve the documentation rate of seatbelt status, including the mild injuries, which only will pave the road for implementation for informed safety measures. This takes me to the end of my presentation. Thank you.